Just bear with me here. You're going to use the chat box for questions, and we'll take those as we go along. So let's get to it. Dr. Michelle Fritsch is a board-certified geriatric clinical pharmacist with a passion for healthy aging and education. She's a specialist in medication use in people over age 60. Dr. Fritsch is an author, founder of Retirement Wellness Strategies, and has been a professor teaching various medical professionals since 1992. Please join me in welcoming Dr. Michelle Fritsch.
Kurt, thank you so much for the opportunity to be here today. And thank you to all of you that have joined us. I'm excited to be talking to you about this topic. We know that COVID has come along and changed everything in the last year, but especially being employees of the USDA, I am fortunate to have grown up in a small rural farming community in Indiana. And so I'm aware that there are so many other factors that are changing people's lives, including climate change right now. So it's a lot of that perspective that brings us here today. And I want to kind of take us a little bit on a roller coaster. We're going to talk a bit about some of the issues that we're facing right now. And it's going to get maybe to what's going to feel like a dark spot, but then we will bring it back to some very specific, tangible things that you can do yourself and things that can help your family through these times. And maybe even some elements of this that we're not aware of that are really impacting people's health. And so I want you to be aware of those things and be able to take appropriate action. So let's get started. We're talking about hope and health. So I just want to do a little bit of spend some time talking about terms with you. And if you've come to this running from another meeting or you've been on Zoom all day so far, I encourage you to take some time to sort of relax and maybe stretch a bit as we get into these important topics. And I want to start with 3 questions that I want you to ponder a bit before we get more into the informational section. So question number 1 is, when you think of the word hope, what does that mean to you? And I want you to take a few seconds to really picture that, think about that. So I'm going to pause for a minute and hope that hope brings some great thoughts to mind. I thought this slide was especially appropriate because I think we'd all love to be on a beach right about now in some sunny weather. So as you think about hope, I want you to also consider, what does well look like? Because we toss that word around. I talk a lot about wellness, but what does that mean to you? And if you've not given it a lot of thought recently, let's just take a few seconds and kind of categorize in your own mind, what would it mean if I were to be able to say I am well today, or my loved ones are well? What does that mean? Selfishly, I have to tell you, I hope I'm going to really expand your concept of that by the time we're finished today. And my third big question for you, so we've talked about hope and what is that exactly? And well, what does it mean to be well? And I have been fascinated to spend a lot of time the last 2 years really understanding how this next one is impacting your health. So my third question is, have you thought about your purpose, your reason for being, your reason for getting up each day? So I want you to think about that. And I'm perhaps shouldn't be surprised that a lot of people have not given this a lot of thought. And since one of the things we're talking about today is retirement, which is a big life transition, sometimes we find that our purpose during the active part of our career and our purpose after we transition to retirement or whatever comes next for us, that shifts. So even if you're pretty clear on your purpose right now, Have you thought about what that's going to be as you transition to the next phase of your life? So with these three big questions in mind, let's dive into some information. And as Kurt said, please at any time, I would love for you to put questions and comments in the chat. And we're going to stop periodically to talk about those because I want this to be interactive. We're all tired of sitting and listening to presentations at this point. So please interact with me. It will make this a lot more fun for all of us. So health. A lot of times I find that people think of health as their physical health. I have a sprained ankle, or I have diabetes, or I used to have asthma as a kid and I don't struggle with that anymore. But health is so much more. So I want us to think about our mental health, and especially in the year that has been behind us and probably the months ahead of us. Our mental health has taken a lot of abuse, if you will. I know many people, even if it's not a chronic diagnosable condition, they're struggling with some depression and with some anxiety at different times. If that is you, you are not alone. And then there's our social health. I kind of wish we did not use the word social distancing, because this is a time when socially we need to stay connected. We need to be more purposeful about our connections than maybe we were before. Physically distanced, yes, to try to decrease the amount of spread of the virus, but socially connection is really important. I know too many people that are very isolated right now, feeling that they can't really leave and be with others in person because of the virus, but maybe not as technologically savvy, or in other ways just not feeling like they've got great mechanisms to connect with people. And then there's our emotional health. It's a little bit different than our mental health. Emotions are sort of those feelings and those events that happen day to day. And we can choose whether we kind of ride the waves and really have wild swings during the day, or if we kind of find where is our anchor and we make those waves a little calmer. So we're going to talk about some techniques to do that today. And then spiritual health. Now that is whatever that means to you, but there's a lot of evidence that we were created as spiritual beings, however we express that. And I find with my patients over the years that if any one of these is not aligned, if it's not healthy, then it impacts their overall health. It's not just the physical health and the diagnoses. All of these things can have a big impact on your overall health and wellness. So if that's a new thought, I encourage you to kind of think about that. Maybe let me know what feels really new about that and how it might impact what you do moving forward. And again, we're going to get into some specific tips here. Another way to think about this is our biological health is kind of our physical health. And then there's our psychological health, our social health, and our spiritual health are all put together. And so when you think about who we are as very basic human beings, this means that we all have in common a need for having some meaning and direction in our lives. We've got to have a reason to get out of bed, a reason to do what we do over time. We all need to feel like we belong and we have worth, that we're part of something bigger than ourselves. And then we all need to reconcile to love other people and to be loved. And no matter how autonomous you are, no matter how powerful you are, these three elements are common among all of us. Just like we've all put on our pants kind of the same way, we all have these core elements that are important parts of who we are. And most of the people I'm talking to lately feel like they've kind of taken some punches in these areas this year because of so much dramatic change that's occurred. So one of the things that seems to be really kind of throwing people off their center is the input that is constantly coming at them. And I find it fascinating that before COVID ever came along, there was more and more evidence for our kids, in particular like teens and young adults, that all the screen time and the social media that was consuming them was not healthy. And how ironic, is that the word? It is that we've moved from starting to get our arms around this is not a good thing to the whole world going virtual. Everybody's getting a whole lot of screen time. There seem to be most people are spending a lot more time with social media. So we're all seeing the potential negative effects of that. So I encourage you to think about two elements of that. One is how much time per day are you spending? I'm not saying like go off the grid and no longer be connected to what's going on. I think it's okay and probably important to stay up to date, but rather than watch it all day long and frequently, limit the amount of time that you're spending thinking about the news and the current media. And the other one is the time of day. I encourage you, most people probably grab their phone as soon as they wake up and they're checking out the news and what has happened. And then it's often the last thing people look at before they go to bed. But think about how different your day could be if you woke up not yet looking at that and focusing on some things that are more positive. And same at night, doing some different things to kind of allow yourself to relax and get away from it a bit before you try to sleep. And you can imagine we're going to go into that a little deeper here in the next few minutes. And then what other thoughts are you putting in your brain in addition to all of the sort of chaotic news that's coming in? I'm kind of surprised sometimes that people haven't thought about that. You kind of need to balance that out, put in a little good with some of the more stressful things. So speaking of stress, just do a little bit of a personal inventory. How do you personally handle anger, criticism? People cut you off as you're driving or drop a door in your face, something really annoying. How much do you beat yourself up if you fail to do something and maybe you realize, oh my goodness, I missed that deadline or I didn't complete that project? How do you handle the sadness in your life or disappointment? How are you managing financial insecurity? We know a lot of people are doing just that right now, or social unrest, or the pandemic itself. So think about your own strategies. And if you're thinking, whoa, I don't have a lot of strategies, I hope that will be completely different at the end of this hour. Now, we know that when the doors open, we're going to find a lot of things. When we all come back out of our houses and come back together, we know that there are a lot of things we're going to need to think about. Most of us have probably experienced some weight gain and some effects of stress. Use of alcohol and other substances, addiction rates have gone up, and probably some abuse. We're going to talk in a minute about how our fuses have gotten really short, just with all of the things that we've been dealing with. So some of the COVID realities, and I think the data on this is so much emphasis in our public health sector has been put on the pandemic itself, that data collection is lagging a little bit in these important areas. I think we're going to learn this data soon about the amount of abuse and overdose and the sort of epidemic that was within the pandemic of opioids and tobacco abuse, alcohol use, cannabis, the pornography industry, and gambling, and other things that can be addictive. So now that we're here in this sort of low place, Kurt, could you share, are there any questions that have come in at this point?
No questions yet, Dr. Fritsch. Just a reminder to everybody, if you have a question, just type that in the chat box.
That would be great. Questions, comments, insights that maybe are coming your way. So there is literature. I'm coming from a science background. Kurt mentioned I've been a professor for forever, so I've got to find the evidence. There's evidence that when we hold on to grudges, hold on to blame, my life is where it is because so-and-so did such and such to me, when we're isolated, and especially right now, a lot of people are experiencing that, oppressed in any way by other people, harboring resentment, just feeling really bad for our own selves, or feeling rejected. All of those things are very closely related to actual impact on our overall health. and poor health. I doubt that surprises anybody, but yet it might be something that you haven't really thought about before. When I talk to people, sometimes it's sort of an aha moment that, well, that makes sense. When I hold on to all that negativity, it's going to impact me in a lot of ways. I've had a number of patients with chronic, horrible pain conditions that really stemmed from holding on to some things that have happened in the past and never having an opportunity to figure out how to let those go. Now, one of the ways that that frequently plays out is, you see my circle here and it's got arrows, but you could put these arrows any direction you want. When we are anxious, our pain magnifies. It feels so much worse. And when we're anxious or in pain, it is so hard to sleep. And when we don't sleep well, we are much more likely to be anxious and our pain is going to feel worse. So this becomes a really vicious circle. And I know a number of people who are caught up in this. And so breaking out of it can be difficult, but once it's done, all of these things start to improve. And there are ways to break out of this. If we can get the pain more under control, if we can find other ways to deal with our anxieties and our anxious thoughts, if we can take steps to enhance our sleep, any of those things are going to help break this cycle so the anxiety is reduced, the pain is not as severe, and we're able to sleep and rest well. So I'm just going to touch on sleep for a minute. I love the sleeping kitten picture. Kind of makes you want to relax when you see that. But one of them we've mentioned, not revving ourselves up, not getting ourselves anxious by watching news or horror movies or things that stimulate us right before bed. Trying to do more calming kinds of activities. And it's up to you what that looks like. It might be a hot shower. It might be a leisurely walk. It might be sometimes people like different sort of scents in their room or squirted on their pillow. Sometimes it's just a time to decompress with another person that kind of calms you down. And then if you look, there are a number of noises out there that can actually help calm your thought process and help you sleep. In particular, if you're one of those people who your thoughts kind of go crazy, and especially if they become sort of negative, anxious thoughts, sometimes your brain starts to focus on the noise and can more easily allow you to relax. And so there's pink noise and white noise and brown noise, and then sounds of the ocean or crickets or whatever sort of relaxes you. And when I say noise, it's something like a shh sort of background noise. And again, that can kind of take the attention of your brain and focus it and allow the other thoughts to disappear. So if you don't have a regular sleep pattern, or you're finding that it's difficult to sleep and you've never tried any of these things, I highly encourage you to do these because, again, when we sleep better, we're able to manage our thoughts better. We're less likely to be in severe pain. It just sort of allows us to breathe and think and operate in a calmer mode. And the other thing is, right now, with all of us working from home, it's very easy to spend all of your time in a seated position and not really move. And so movement, especially during the day while the sun is up, kind of tells your body, okay, now we're awake. And that can differentiate the cycle as you're getting ready for bed. So I'd love to hear your thoughts. And if anyone's out there saying, oh, I sleep well because of sleep medicine, don't hate me, but I really discourage the use of medication to help with sleep. I would much rather see you try all of these other things before we use medication, for the primary reason that sleep that's induced by medication does not go as deep and is typically not as restful as your own natural sleep rhythm. And so there are a number of ways we can help people fall asleep, stay asleep, or get back to sleep if they get up during the night that don't involve medications that tend to allow for more overall restful sleep. If at any point I'm talking about something that you're like, oof, I really need to talk more about that, either put the question in the chat or I'd love to talk to you later one-on-one. Just let me know.
Michelle, we do
Yes.
have a question. Could you talk about how our diets affect our sleep?
Yes. The things that kind of come to mind first are when we have more spicy food late at night. It's going to cause more of the heartburn, and that can make it harder to sleep. If you've done that, then use of Tums or even a glass of milk to kind of calm the burning can be helpful. Or if you sleep really flat, depending on your type of bed, you can elevate yourself just the tiniest bit, like 2 inches. And sometimes that helps decrease the heartburn. And the other one is alcohol. A lot of times we think, well, a drink in the evening will relax me and allow me to sleep better. But kind of like medication, sleep after drinking alcohol tends to not be quite as deep and restful as natural sleep. So I'd encourage you to at least have some nights where you don't consume alcohol in the evening to try to have a better sleep pattern overall. And then anytime there's general fullness, if we've overeaten during the day, then that, especially when we lay down, kind of presses on our diaphragm and can kind of cause again more of the heartburn, or the fullness, or the feeling like you're kind of being suppressed in our breathing symptoms. So trying to not overeat and avoid the spicy things, the alcohol toward evening. And this one is really difficult for me, but chocolate's another one that can kind of cause the heartburn. So trying to limit that as you get toward bedtime as well. And if whoever asked the question, if you wanted something a little more specific or had a different thought, please share that. So I want to try to describe this in a little bit different way, how our current times are impacting our health in so many ways. So I'm going to start with stress and fear. At least at some point in this pandemic, I don't think I've met anyone that's not had times and maybe still has times where they're experiencing some feelings of stress and fear. When we have those, and raise your hand if this is you, we tend to stress eat and drink. I think, oh, I don't see hands raised. Come on. I can't be the only one that's eating the ways that I probably shouldn't right now when I'm feeling stressed. And another one is poor coping. We might be really good at coping when things are kind of being lobbed at us gently, like picture a little boy playing t-ball kind of thing. When things are coming in gently, we can kind of cope with them. But when it feels like everything's raining in at once, our coping skills sometimes are not as good. We're more likely to lash out. We're more likely to want to maybe just pull into the fetal position and just not cope with it. And then anger, I mentioned earlier that fuses are short, because it feels like we're constantly getting more information that's more change, more news that maybe is not the news that we want to hear. I'm finding that people's time from the time they're presented with something they don't like until they kind of snap is getting shorter and shorter and shorter. About the only way to turn that around is to truly give yourself some big breaks from all that news and from all that information that's coming at you. And then another one is our sleep. When the stress and the fear are kind of overriding our thoughts and our actions, then our sleep tends to not be as good as well. So then what does that mean? Well, those things often lead to an increase in our blood pressure. So now we're getting back to more the physical health. When we are stressed, our veins and arteries are squeezing together tighter. They are pushing that blood through. Our heart is having to beat harder and sometimes faster to deal with all of this sort of adrenaline that's driven by this fear and stress. And as our blood pressure goes up and as we're going through these situations, often our weight goes up. Part of that is the stress eating and drinking, and part of that is just the hormones that are released when we're stressed tend to cause us to retain more fat. And then as our weight goes up, then our risk of diabetes and having a higher blood sugar tends to increase as well. So maybe that puts you at risk for diabetes where you weren't before, or you already have diabetes, but now it's even harder to keep your blood sugars in line because, again, it's all of these factors working together. And then when our weight goes up, when our health is declining, then the possibility, if you will, of chronic pain just amplifies. And when we're in pain, that feeds right back into the fear and the stress. So this is where I'm encountering a lot of people that I work with are someplace in this cycle. And there's more than one way to try to address this and pull people back out of it, or at least to minimize it. So I want to focus on some of those. In general, I talked about the literature and the data. I have to do that as a scientist. So just as there was information that said all of those negative things have a direct negative impact on our health, all of these positive things have a direct positive impact on our overall health, our immune system, our ability to fight infections when they come our way, our how long we live and how healthy we are through that time that we continue to live. And so part of that's engagement, goes back to relationships, finding that more optimistic approach to things. And part of that is hard to do when you're feeling burdened by all of the negative input. So again, you've got to almost get away from it for a while to find your optimism. Be surrounded by the people that make you laugh, the people that make you feel good, the people that build you up. Regaining your ability to bounce back. Conflict management skills. This one always makes me laugh because I don't think anybody is born with really good conflict management skills, but they can be learned. And the better we learn them, the better we're able to apply them, then that improves our own health and the people around us. And then there's evidence that people that believe in a higher power tend to have better overall health as well. And again, I don't want to describe for you or dictate what that is, but coming back to that spiritual aspect of your health, giving that some attention has a positive impact on your overall health. So there's a lot here. There are a lot of things that you might be able to make some changes to enhance what's going on in your health. And to spell it out sort of a different way, we talked a lot about sleep, but sleep is so integral to your overall health. Avoiding triggers, whether that's people or events. Maybe it's watching the news at night tends to get you wound up and make it difficult to sleep. Finding and then avoiding your triggers, or at least I know with relationships, you can't always avoid those people that trigger you, but trying to be respectful with some time boundaries, and then on the other side, spending time with the people that really build you up, in addition to those people that trigger you, can be helpful. That's something that I talked with clients a lot about over the holidays. And then how are you moving? Don't just sit at your desk all day. That's not good for us in a number of ways. So finding those opportunities to move and stretch and do some strengthening, get out in nature, taking walks, getting outside of the house once this snow is gone. Spending time with music that lifts you up or calms you down, rather than necessary music that tends to sort of aggravate you. Finding ways to relax. And oh my goodness, the number of tools available to help you relax has exploded during this time of the pandemic. And so if you just go to your favorite search engine and just type in like relaxation tips or relaxation music, I'm amazed at the number of things that are there. I personally have been listening to this soundtrack that's just acoustic guitar music that's really soft. And if I have that on while other things are happening, it kind of gives me a layer of calm in the midst of everything else. Finding your support network, and then kind of back to conflict management. So again, I'm going to pause for a minute and have you kind of do a personal inventory. Which of these things do you do regularly? And which of these things might you be able to add to your toolbox to help you enhance your overall health, especially while we're still cooped up and somewhat quarantined with the pandemic? And while I'm pausing, Kurt, is there any new information that's come in?
No questions. Now, I have a comment though,
Sure.
and that's around, I would call it the triggers. Something I learned that I've employed that's helped me is what you talked about, and that's avoiding my screen, whether it's my phone or my laptop, first thing in the morning or at the end of the day. And, in the morning, it allows me to take care of myself, to structure my day the way I want and think about what I want to accomplish versus being impacted by the news and triggers that might throw me off and ruin my whole day.
Right.
So that's been helpful.
How hard was it? Like, did you have to consciously make a shift from starting your day differently to doing it in this more positive way?
Yeah, it's a transition. The way I think about it is I own the first hour of the day. That's my time. Coffee's important to me. I always start my day with coffee. That's my first thing.
Hmm.
Um, Stretching helps, meditation, prayer. I journal. I have a checklist of things I like to run through, I'm intentional about it before I check email or look at the news or even look at the weather. It's that's my time, and that allows me to start my day the way I want to.
Thank you for sharing that. I think that might be inspirational to a lot of people because most of the clients and patients that I've worked with over the years, that is not the way they start. And I think we could all benefit very much from that. Let's shift gears just a tiny bit. And, we've been talking about how to take care of yourself. Let's also think about how do we take care of our colleagues and our family members, our neighbors, the people around us. Because it's interesting that the more we give to others, that actually does have a big impact, positive benefit for us individually as well. So, what might that look like? One is I encourage you to share this with everybody you know, because as a pharmacist, I usually have to talk to people several times before I get the full picture of absolutely everything they take. We think we're sharing it, but let me kind of give examples. A lot of people, if I ask, what medicines do you take? They'll share with me their prescription medicines. Sometimes only the ones from their primary care doctor because they forgot about the ones from the specialist. But most people will at least give me all of their different prescription medicines. But then what about vitamins? Not everybody thinks of those as medicines, but I need to know that. For me to know if everything that you're taking is safe together, I need to know the vitamins. And caffeine is already up here. I even need to know that. So does your doctor. We need to know what over the counter medicines do you choose to take on your own? And my goodness, there are so many that you can choose from. Even if you just take them once in a while, we need to know about it. Because if you have a day where suddenly something goes wrong, it may very well be that that particular day you took the cold medicine that you take once in a while and the stomach medicine you take once in a while and the pain medicine you take once in a while. And it was that combination that caused the problem. And what about supplements? There's so many different sorts of supplements, but I want you to think about those as substances you need to tell your pharmacist and your doctor about. Herbal remedies, tobacco. Tobacco can actually change how the body processes certain medications. Holistic medications and cannabis, marijuana, cannabidiol, CBD, any of those sorts of products, all of these things can cause medication interactions. So I just wanted to share a quick story. This is a man that had recently retired. He was fine. He lived alone. But he had no restrictions. His health was fine. And he one day was on the phone, and thankfully, a friend was over and saw this happen. He's talking to someone. He's a very sharp man, and he was talking about some detailed information with this person. And all of a sudden, he completely forgot who am I talking to and what are we talking about? Just complete blank. Now we all do that sometimes for a short bit, but his stayed. Couldn't remember any of it. So the friend thought he'd had a stroke and calls 911. The ambulance comes and gets him, takes him to the hospital. The hospital, it was the weekend, of course, so couldn't get a hold of the doctor. The hospital looks at his medicine regimen and assumes he has a seizure disorder because of the medicine he takes. He stayed very, very confused. And so they sent him to rehabilitation because they couldn't send him home. He failed rehabilitation because he was not thinking clearly. So from there, he went to an assisted living. I mean, this guy just retired. He was perfectly healthy. And now he's in an assisted living in the bed, not really interacting with anyone. Thankfully, we had a chance to come in and look at the situation. And what had happened was his primary care doctor had increased the dose of one of his medicines, and a specialist doctor had started another medicine at the same time. The two of them didn't get a chance to talk about it. And when those two medicines impacted his brain, it shut down his clear thinking. And so once we realized what it was, we were able to, when a medicine impacts thinking in the brain, it needs to be started and titrated up. The dose needs to be increased slowly and carefully. Same on the other end. We've got to go really slowly and carefully to take them back away. So we started that process, and with every single dose decrease, he got sharper until his thinking was completely clear again. But at this point, he hasn't walked in 6 months. That's how long this whole saga took. It took another 3 months of physical therapy for him to be able to go back home again. Now he's home and, living like he did before. But that one medication interaction robbed him of 9 months of his life. And had we not had a chance to go in and figure out what caused it, he would never have cleared from that. He would have stayed in that mental fog for the rest of his life, and that would be a total tragedy. So these details are extremely important, and I highly encourage you to share them with your pharmacist and with your doctor. Have them available. You can put them in your phone, on your app, have them in your pocket. This is critical information that we need to know to begin to make accurate decisions for your health. And along those lines, I talk to so many people who I say, how do you prepare for a doctor visit? And they're like, well, I show up. There are so many more things you can do that if you ever wanted to talk about this more, I could walk you through an entire process for this. But one of the big things is to think ahead. What do you want to talk about? If something new is happening, write out the details. When did it start? How does it feel? Really describe it best you can. Is it all the time? Is it just some of the time? What makes it better? What makes it worse? Because all of these questions, every doctor in the country is going to ask you these questions. Every pharmacist in the country is going to ask you these questions. So if you've already thought about it, you save some of those precious minutes you have with your doctor, and you can get a lot more done in that time. And then this process that I'm sharing with you, I came up with by working with some physician colleagues, and together we thought this is going to help people. Take 2 copies. When you go to the doctor, or even if you're going to have a telehealth visit, have 2 copies of what you want to talk about. One copy gets shared with the person that checks you in. That's like the person that takes your weight, takes your blood pressure, or if it's a telehealth visit, the person that kind of gets on the screen first and, gets a little bit of information from you. Share one copy with that person. They will then share it with the doctor. You keep the other copy for yourself and have a pen handy. And so as the doctor comes in, he or she has already looked at what you want to talk about, saves a lot of time off the beginning of that visit. And then during the visit, the two of you can focus on this list. You're not feeling pressured to remember what you wanted to bring up. And then take notes. As the doctor answers your questions, take notes. Make sure you understand the answer that's given. Every doctor I've ever worked with can't stand it when someone leaves and did not understand what they were just being told. So make sure you understand. If you don't understand, let your doctor know. They can explain it in a different way, or maybe have someone come in. If you're having difficulty like with an accent, they can have someone come in and help make sure that you understand that information. So 2 copies has really revolutionized doctor visits for a lot of people, and they get a lot more accomplished during that time with their doctor. All
Dr.
right.
Fritsch, could you
Yes.
go back one slide, please? We have a question
On all the
about,
medications.
yeah, all of those,
Yes.
yeah, things we take. It's kind of eye-opening because so many things. The question centers around the effectiveness of some of those. Could folks be taking so many different things that some may be less effective or not accomplishing what it's intended to because it's offset by some of the other things they're taking? Is that possible?
Absolutely. I see that every day, every single day. Yeah. So that's why I want to know this list, so that I can help people and help their doctors, their kind of team, figure that out, and gradually reduce the things that are not helping or maybe are actually causing problems, and just leave the medicines that are truly essential. There's a woman right now, she was on, she had a knee surgery. And again, a couple that he had recently sold his business. Um, she had a knee surgery and just seemed to just go into a deep dementia, was not functioning well at all. And kind of similar to the previous story, 3 of the medicines that were started were not interacting with one another well, and certainly she was not tolerating them. And so it was another gradual process. It took us almost 2 months, but got her gradually off those 3 medicines, and she's right back to where she was before. So it happens way too often. It's one of my favorite things to do, though, is resolve those puzzles and help people feel good and feel like themselves again. I get a real charge out of that. Let me touch on COVID for a second. There are currently 71 vaccines in human trials and like 78 in animal trials right now. So there's a lot more vaccines coming. 20 are in the final phase. And as you all know, Pfizer and Moderna each have a vaccine that's being used in our country right now. But I am so excited that this Friday, the FDA advisory committee is going to look at the Johnson & Johnson vaccine. So that will be another 100 million doses that are rolling out. The current plan is, if it gets approved on Friday, 20 million of those doses will be available in March, and the other 80 million by the end of June. But also Pfizer and Moderna are making more doses available by this summer as well. And then we have the Oxford AstraZeneca vaccine that's being used in many parts of the world and is anticipated to go before the FDA soon. And then Novavax is yet another one that should be available in the US soon. So the US preemptively, before, like last year, already purchased at least 100 million doses of each of these. So if you are somebody who's like, oh, it's never going to be my turn to get a vaccine, this is one of the areas where I want to bring in some hope that rapidly more and more vaccine numbers are going to be coming in. And if you're interested, I do a weekly update on this, 10 minutes every Friday. And so that link is here. If anyone's interested, I could send it in some follow-up information if you're interested. And my purpose with that is just to help people understand from a science standpoint, what's the new information that's come out that week in a 10-minute soundbite. I just want to, again, on the COVID side, just kind of say, we're going to see a little bit of variance in some of the numbers from vaccine to vaccine. But keep in mind, the number one reason to vaccinate people is to keep them alive and out of the intensive care unit and out of the hospital. And so even if some of the vaccines don't prevent as many people from getting COVID at all, if it can prevent them from needing the hospital, the ventilator, or dying, that's a pretty big impact. And so it's one of the things we'll talk about on the Friday updates is even if one of them is 85% effective of ever allowing you to get COVID and the next one's 92% effective, that's not as important as are they keeping people out of the hospital? And all of the ones that are coming before the FDA are doing a great job of keeping people out of the hospital and keeping them alive. And one more little COVID related thing. Some people were asking questions a couple of weeks ago and found this description to be helpful. And so before the vaccine, the blue circles are all of us running around who've never had COVID. And the more we interact with one another, the easier it is to spread it from person to person to person. Now, my red circles with the line in the middle are the people who have had COVID. And if somebody who's not had COVID encounters that person, there's not as likely to be a transmission because that person has antibodies to keep them from getting it again. But then if you look over on the right side, the X people are the ones with the vaccines. And notice how that just sort of spreads out the blue circles. And so less likely that there's going to be as rapid of a transmission from person to person to person if we can get a big chunk of the people around us to be vaccinated, which is going to stop the spread between people and going to keep people safer from the vaccine. So please put in the chat if that leaves you with more questions and answers, or if you want more information. But this is my attempt to try to explain just how important these vaccines are. I want to change gears one more time and talk about the purpose part. Remember our third slide, we talked about purpose and what does that mean? So just kind of quickly, Harvard did a study, this is before COVID. Harvard did a study that found that many executives are not happy in the workplace. Like 96% are feeling burned out. That over 50% of the workforce is looking for another job. So think about your own colleagues, think about the USDA, think about the different departments. How many people are really happy and fulfilled in their current position? About 67% of the workforce was disengaged from their jobs. Again, this is all data from before COVID. And this was interesting that 9 out of 10 professionals said they'd take a 23% pay cut to move into a position where they felt truly fulfilled. So when we're fulfilled and living within our purpose, it's interesting that that has huge health benefits. And that's why, again, as a professional in medicine, I've become so fascinated by this. It will decrease your risk of heart disease. It will decrease your risk of dementia. It will allow you to live longer and maintain your stress better so that you don't have that decline in your health until much later in your life. Huge impact on our overall health. So here's a quote I wanted to share. People who labor all their lives, so they're working hard, labor all their lives, but have no purpose to direct their thoughts and impulses toward, are wasting their time, even when they're hard at work. Think about the people you know who work very, very hard, but get no fulfillment out of it. It doesn't fit their own unique design and purpose for being on the planet. And then I want you to look that this quote was written in AD 121. So perhaps there's nothing new under the sun. Some of these struggles that we're having with finding purpose and relevance in the world has been around for at least 2,000 years. And I just found that fascinating. So let me just quickly explain what I do and why I do and why I have such a passion for all the things that we've talked about. I wanted to remind you of self-care, and hopefully you're going to leave this hour with a number of strategies to plug into your own life to allow you to stay healthier and to avoid the things that led me to do what I do now. So I have found too many people who had a very successful career, and now retirement is approaching, or at least it may not be retirement like go home, but they're going to leave their primary career to go do something else. And I have found that up to 2/3, and the numbers are huge, experience this out of the blue rapid health decline. They seemed fine, and then boom, their health has declined. I mean, I've been in academia and practice in healthcare systems for almost 30 years. And I've seen so many people laying in hospital beds and realized that was completely preventable if we could have just been in front of it. And a lot of times it's this rapid health decline. It's divorce. The divorce rates in people over the age of 50 are going way up. The level of despair. I know farmers is one group of people that are having a rapidly rising suicide rate. I can't stand that. We've got to get in there and figure out what can we do to change that outcome. And then declining overall relationships, just people being able to stay connected to one another. So I found that if we can focus on health and help people plan before the retirement comes, have strategies to be healthy in all of those elements of health. Remember that one that had the physical, mental, social, emotional, spiritual, all those elements of health, and identify their purpose in that next phase of life. That goes a long way toward having a really successful next phase where it's fulfilling. That person is getting a lot out of it. Their family members are benefiting from them being healthier. All of their community might end up benefiting from who they are and what they're doing now. So I left all those years in academia, in an administrative position, working in healthcare to pursue this, because we've got to do something about this and prevent all of the decline that is preventable. So I find that a number of people find that, time flies by fast. You're really focused on your succession plan, getting everything done before you leave the workplace. And then you haven't taken care of yourself. And that's where you find out that retirement's not what you anticipated, because you're just not prepared and you're not as healthy as you could be. And so I want you to leave here thinking about how big and robust your team is and how to pull all those people into your plan to have a different outcome, to have a really healthy, long retirement. So that's you, your family, all of your physicians. We talked about that one story where the primary care doctor and the specialist hadn't talked and it led to a really bad outcome. Turning Point Financial, that financial piece, the legal piece is important in your planning. And then I offer up retirement wellness strategies. A lot of people call me the quarterback of their healthcare, because I make sure that all the members of the healthcare team are on the same page, making good, accurate decisions on your behalf. So I believe that people should have quick access, somebody to turn to when they have health questions, have somebody to walk with them side by side when difficult diagnoses do come in and they're dealing with those things. Somebody who coordinates all their healthcare providers, again, make sure that nobody makes an uninformed decision on your behalf, because that leads to a lot of the medical errors that occur. And then helping you identify and live that purpose, because that has such a big impact on your health and the health of everyone around you. So I've built a process. I encourage you to check it out. I'm going to send you some information so you can understand it better, but I'll talk to you about that purpose. I call it the meaningful piece, the active, how do you stay socially active and maintain relationships? A story comes to mind where a man had all of his plans. Retirement was planned. He was going to move to Florida to this. He had the community picked out. It was among a bunch of golf courses, and he had some friends who were going to move to a similar area so they could spend time together. It was going to be Florida. It was going to be great. He had it all planned out, and his retirement was just this close. He mentions it to his wife, and she said, "I will never live in Florida." So back to the drawing board they went. So those relationships and making sure that you're talking with the other important people in your plans is a big component. I call this sustained, but helping people identify their risk factors. There are a lot we can do, a lot of things we can do to know your risk factors and minimize those. But our current healthcare system kind of waits until things happen, and then we come in to help. I want to get in front of that and minimize those things happening, make sure that we take every effort to keep you safe, and then really bring all of your health details together so that, again, all your healthcare members have the information they need to make good decisions. So that's my process. It's retirement wellness strategies. I very much appreciated being with you here today, and I'm going to give you some ways to call me to ask more questions or to engage if you find that there might be some holes in your retirement plan that we could fill together. So again, Kurt, thank you so much for this invitation.
Thank you, Dr. Fritsch. Let's we're gonna stick around a few more minutes. It's almost 1. Folks, if you have a question, you can put that in the chat, or feel free to reach out to Dr. Fritsch. Here's her email address and her phone number. There's a copy of her book. I mentioned she was an author. She can, if you're interested in the book, she can tell you how to get a hold of that.
Yeah.
If you have any questions, just pop those in the chat box, please.
Just put in the chat box. Did you find some things that, just a yes or no, did you find some things that you might do differently or try differently to help preserve your health as we continue through this pandemic?
Absolutely. Yes. Yes.
Good.
Thank you for giving us things to think about. Someone's asking do you have a list of do's and don'ts for retirees and pre-retirees, or is that on your website?
You know what? When I send some information out, I'll include a survey that kind of is a self-assessment of, are you ready? Are you ready for retirement? Have you thought about all the things that I think are important to maintain your health? So that will kind of be like a do's and don'ts.
Well, Dr. Fritsch, thank you very much for being here. It was a wonderful and incredibly informative presentation. My contact information is here on the slide for anything financial related. Folks, we're going to let you go. We appreciate your time. Thank you so much for being here. Be safe, stay healthy, and let us know if we can help.
Thank you all.